Hi everyone, let's see about hypocholesterolemic and anti-diabetic compounds in plant sources. First, diabetes mellitus. It is a chronic metabolic disorder. This is because of improper glucose utilization. Yes, because of the improper glucose utilization, there will be an elevated blood glucose level. Yes, that condition is called hyperglycemic effect. Yes, causes of this hyperglycemic effects are inadequate secretion or no production or improper action of insulin from the beta cells of pancreas. Yes, diabetic patients should undergo lifestyle changes, dietary modification and medication. Yes, these three things are best insulin sensitizers in the management of diabetes. Yes, these three things, that is lifestyle changes, dietary modification and medications. These are very important to manage the diabetes. Hypoglycemic effect foods which are termed as anti-diabetic compounds. Yes, let's see about anti-cholesterolemic effect compounds. Yes, cholesterol is a compound of sterol type which is found in most body tissues. But high level of cholesterol which is present in blood, that condition is called hypercholesterolemia. Hyper is nothing but increased level. That is increased level of glucose which is present in blood. That hypercholesterolemia which is associated with the cardiovascular diseases. Yes, to prevent cardiovascular disease, foods which are rich in hypocholesterolemic effect, that is it helps to lower the cholesterol level in the blood. That effect compounds that are useful for to control the hypercholesterolemia. Yes. Let's see about anti-diabetic compounds. Hypoglycemic effects in the plant sources are most probably through their fiber content present in the food items, or the nutrients which is present in the food, or the phytochemicals present in the food. Yes, anti-diabetic agent, it has both nutritional and non-nutritional compounds. Apart from that, minerals, it acts as a cofactor for signaling the intermediate of insulin action. Here, it is a key enzyme of glucose metabolism. So in case of vitamin C and E, along with the phytochemicals, which prevent the oxidative stress induced complications and the dietary fiber. In case of vitamins, vitamin C and E along with the phytochemical helps to prevent the oxidative stress induced complications. Then dietary fiber aids the management of blood glucose level. In this first compound, that is eugenol, this is a bioactive component which is present in tulsi and cinnamon. The chemical name of eugenol is 2-methyl-4-allyl phenyl. This phenolic compound is colorless in nature, or sometimes it is pale yellow in color. The main action of this eugenol is it helps to reduce the blood glucose level as well as the glycosylated hemoglobin level, and also it increases the plasma insulin level. Because it has an effect on, it has an hyperglycemic effect. Because it has an anti-hyperglycemic effect. So apart from that, it possesses antiseptic property, anti-inflammatory property, neuroprotective, antipyretic and antioxidant property. This is a picture of tulsi and cinnamon. Next is grapes and parsley. The compound which is present in grapes and parsley is apigenin. Chemical name of this apigenin is trihydroxyflavone. This is a yellow crystalline substance. It helps to store the glucose in the form of glycogen in the liver and muscle. Thereby it reduces the blood glucose level. So it acts as apart from that, it acts as an anti-inflammatory agent. It lowers the blood pressure. It has an antibacterial and antiviral properties. This is a chemical structure of apigenin. This is a picture of parsley and grapes. Next is cocoa and chocolate. The component which is present in the cocoa and chocolate is theobromine. The chemical name of theobromine is 3,7-dimethylxanthine. This is white color, or sometimes it is colorless in nature. Which is present in the choco or cocoa helps to increase the insulin secretion and improving the insulin sensitivity. And also it helps to prevent the oxidation. Apart from that, It functions as diuresis. It helps to dilate the coronary arteries and acts as a vasodilator. Thereby, it reduces the blood pressure. This is a picture of cocoa and chocolate. Next is curry leaves. Gyrinambin is a bioactive component which is present in curry leaves. The chemical name of curry leaves gyrinambin is 3,3,5-trimethyl-11H pyranol carbazole. This is a carbazole alkaline compound. It helps to induce the insulin sensitivity, which is secreted by the beta cells of islets of Langerhans of pancreas. It reduces the postprandial glucose level. And also it acts as an antioxidant, anti-angiogenic effect, anti-inflammatory and anti-platelet activity. Next is saffron. Safranol is a component which is present in saffron. The chemical name of safranol is 2,3-dihydro-2,2,6-trimethyl-benzaldehyde. The carotenoid which is present in this is zeaxanthin, bioactive component which is responsible for the aroma of the saffron. That is, for the flavoring concept, this component is responsible. Saffron reduces the fasting blood glucose level and also glycosylated hemoglobin level in blood. That is HbA1c level in blood. So it acts as an antioxidant. It has an antidepressant property and anti-convalescence property. This is a structure of saffron. This is a picture of curry leaf and saffron. This is bitter gourd. Charantine is a bioactive component which is present in bitter gourd. It is a mixture of two saponins. It consists of two fused benzene ring. It has an effect on lowering the blood glucose level by insulin secretion, by increased insulin secretion. Other uses of charantine are, it acts as a antibiotic agent, it has antifungal property, antimicrobial and antipyretic property. This is a chemical structure of charantine. Next is about hypocholesterolemic compounds. Cardiovascular disease is the largest single contributor to global mortality. Yes. CVD is a major public health problem. Yes. Several lifestyle factors including the rich saturated fat diet and poor dietary fiber may contribute the development of CVD. So these two factors are the main factor for the contribution of the development of CVD. The first is about the rich saturated fat diet and the next is about poor dietary fiber diet. So both the things are very important. So CVD is associated with elevated plasma glucose and lower HDL and increased LDL. Oxidative stress, especially the vasculature and kidneys, contributes to hypertension, which is a major risk of CVD. These are some of the functional foods and nutraceutical components which helps to reduce the risk of cardiovascular disease. Cumin seeds. Compound which is present in cumin seeds are thymoquinone. The chemical name of thymoquinone is 2-isopropyl-5-methyl-1,4-benzoquinone. It has a phytochemical compound. It reduces the risk of hyperlipidemia, that is, increased level of lipid present in blood, and hypercholesterolemia, that is, increased level of cholesterol present in blood. So it helps to prevent osteoporosis and cardiac related problems. And also it acts as an antioxidant. It has an antidepressant property and anticonvalescent property. Next food is cabbage. S-methyl cysteine sulfoxide is a component present in cabbage. The chemical name of this S-methyl cysteine sulfoxide is 2-amino-3-methyl-sulfonic propionic acids. It reduces the cholesterol and prevents hyperlipidemic action. It also, other uses of this S-methyl cysteine sulfoxide is antioxidant and it reduces the serum glucose level. So it has both hypocholesterolemic and anti-diabetic property. This is a picture of cumin seed and cabbage. The next is about ginger. Sagoyal or gingerol, which is present in Ginger. This is a phenolic compound. It reduces the plasma and hepatic low density lipoprotein level. Yes, hepatic LDL, and it reduces the plasma, both hepatic and plasma LDL. So it reduces the risk of cardiovascular diseases, hypertension, hyperlipidemia, and platelet aggregation. Next compound is nuts and oil seeds. DHA and EPA, that is docosahexaenoic acid and eicosapentaenoic acid. These are the two components which is present in nuts and oils. This is a unsaturated component. Saturated fat or saturated rich diet which is bad for our health. Here the DHA and EPA, these are the unsaturated component which is present in nuts and oil seeds. Helps to reduce the LDL cholesterol and reduce the formation of plaque. Thereby it acts as a cardioprotective agent. Apart from that, it reduces the inflammation and platelet aggregation. Thank you girls. Bye bye. See you in the next class.